This model is showing the abdominal vessels. You have here the abdominal aorta, the large vessel here. The abdominal aorta then branches to the common iliac arteries, and then the common iliac artery then branches into the external iliac artery and the internal iliac artery. You also have at the top of the aorta, right below the diaphragm, is the celiac trunk, then the superior mesenteric artery, the inferior mesenteric artery, and you have the renal arteries that go to the kidney on the side of the renal artery. This is the inferior vena cava, which brings blood back up from the legs and the abdomen. You have the renal veins, and you'll notice that the renal vein for the left side, the left kidney, is longer because it has to go over the aorta. Off of this left renal vein, you have the gonadal vein, which goes to the either the ovaries or the testes, and then the inferior vena cava also branches into the common iliac vein, which then branches into the internal iliac vein and the external iliac vein. The kidneys, right here, these are the ureters, which take urine down into the bladder. On this model you can also see the heart, different chambers of the heart, the superior vena cava, the aortic arch, right atrium, right ventricle, apex of the heart right here, left ventricle, and the left atrium. Up here in this structure, right here, is the left auricle, and on this one, this right here would be the right auricle. Okay, this is showing some of the veins and arteries of the body. Again, you have the heart. Now, the major vessel going to the lungs is here, the pulmonary trunk. Goes into the lungs, comes back via the pulmonary arteries. And you have, again, the aorta and the aortic arch that carries blood to the body. This here is the abdominal aorta. And going back up here to the heart, again, we have the superior vena cava, which goes into the left and right brachiocephalic veins, which then go into the left and right internal jugular, which go up into the brain and the head. It also branches into the left and right subclavian vein, which goes underneath the clavicle and into the arm. This major branch here is the cephalic vein, and then the basilic vein goes into the arm. On the abdominal area, you have the inferior vena cava, which carries blood from the lower limbs and the abdomen back to the heart. The two branches going to the kidneys are the renal veins. Down here it branches into the iliac veins and eventually becomes the femoral vein. Some of the arteries to note back from the heart, you have the aortic arch. On the first branch on the right side is the brachiocephalic trunk, which then becomes the common carotid artery, the subclavian artery, the left subclavian artery, right subclavian artery, which then becomes the auxiliary artery, and then the brachial artery. The brachial artery branches into the ulnar, the radial, and the ulnar arteries. Next, from the aortic arch, the center branch is the left common carotid artery, and then the next one is the left subclavian artery, which again goes under the clavicle, becomes the auxiliary artery, and then becomes the brachial artery, which then branches into the radial and the ulnar artery. Going down into the abdomen, you have the abdominal aorta. The branches onto the kidneys, again, are the renal arteries. Right here, this little branch is called this celiac trunk. And going further down, you have the common iliac artery, and then further down you have the femoral artery, which then branches into the tibial and the fibular arteries. Again, you have the right ventricle, the left ventricle, and the interventricular septum. We're going to now look at the inside of the heart, but for reference, this is the left auricle, the right auricle, part of the right atrium, and the left atrium. This is the pulmonary trunk, and the aorta, and the aortic arch. Now, off of the aortic arch, you have the brachiocephalic trunk, which then branches to become the right common carotid artery and the right subclavian artery. Then the next of the third branches of the aortic arch, the middle one, is the left common carotid artery, and then the final one, the third one, is the left subclavian artery. Coming into the right atrium is the superior vena cava. Above that, superior to that, you have the left and right brachiocephalic veins. The large trunks here, brachiocephalic vein. Now, on the left side, you have the internal jugular and the left subclavian vein. On the right, you have the right internal jugular and the right subclavian vein. Now we're going to open up the heart. This is the right ventricle. On the inside of the walls, again, you have pectinate muscle. This is the tricuspid valve. And again, the right ventricle goes into the pulmonary trunk, so you have the pulmonary semilunar valve. Now, these little cords that hold the valve in place are called chordae tendineae. And these chordae tendineae are attached to muscles on the wall of the heart called papillary muscles. And you'll remember the word papillary from when we studied the integument. In the dermis, you have the papillary layer. Papillary muscles, chordae tendineae, pectinate muscle, tricuspid valve, pulmonary semilunar valve. Now, moving on to the left ventricle, again we have the same thing. You have pectinate muscle, and these large, more defined muscles are papillary muscles. These hold the chordae tendineae, and this is the left atrioventricular valve, or the bicuspid valve, or the mitral valve. Opening up the left atrium, again, you can see some pectinate muscle on the wall here, and of course the 4 pulmonary veins enter into the left atrium. Opening up the right atrium, again, pectinate muscle on the wall of the heart, and you have the superior vena cava. On the inside, you have the inferior vena cava down here, and then you have the coronary sinus, the opening of the coronary sinus, this little blue dot, and then the fossa ovale is deep under here, where that sort of light area is. That again was a fetal hole between the 2 atrium. An easy way to remember if the veins go to the atrium or the arteries go to the ventricles is that a word that starts with an A always goes to a V, and a V always goes to an A. So you have veins that go into atrium, that go to ventricles, that go to arteries, that again go to veins, go to atrium, to ventricle, to arteries.